Good morning, everyone. I'm Amanda Campen, and I work with the Massachusetts Emergency Management Agency focusing on public assistance for COVID-19. I just want to thank everyone for participating today in this applicant all hands focusing on schools and educational facilities. Just to go over some housekeeping in order to be respectful of everyone's time this morning, we have placed everyone on mute. So if you have any questions that you would like to ask now or during the presentation, please utilize the chat function, which is the button that has the dialogue symbol on it, and submit your question. Make sure that it gets sent out to everyone and you don't do a private chat. So we will be getting to those questions at the end of this session in our Q&A. If we do not get to your question at the Q&A because we run short of time, we will be publishing all of the questions asked with responses and answers to those questions on the MEMA website early next week, along with a recording of this presentation, as well as a copy of this PowerPoint. So you will literally have all of the materials that we will go over in this presentation at your disposal on the MEMA website, hopefully by early next week, if not later next week. We will also be sending you a follow-up email early next week to let you know when those materials have been posted on the MEMA website and where to find them. And again, we will be getting to the Q&A at the end of the session, so make sure you are submitting your questions as we go along. Before we begin, I would like to introduce MEMA's Assistant Director for Recovery and Mitigation, Thad Lemors, to give us some opening remarks. Thad, the floor is yours.
Thanks, Amanda. So I want to thank everyone for taking the time to jump on today. I won't say a lot so that we can get to the meat of this, but obviously this disaster is unprecedented, and for many reasons, for both you, us, and FEMA. And I should add that our partners from FEMA Region 1 are on the call today. They've been great partners through this as we navigate both this disaster and the policy that has been coming down from FEMA headquarters. The group of FEMA folks that are on today are our local team that are in the trenches with us trying to figure this out as well. So to the extent that some of it may be confusing or frustrating, I caution, don't shoot the messengers that are here with us trying just as hard as we are. So, but that said, it's also unprecedented in the sense that this disaster is still ongoing, right? You have a hurricane, you may have an incident period that lasts 1 or 2 days, or even a flood out in the Midwest in maybe a couple of weeks. But here we are still in what we call the incident period, in that the costs that applicants are incurring now are still eligible and will continue to be eligible until the incident period closes and the public health emergency closes. So we're talking through the winter and through the vaccination is what we're looking at. So we thought it'd be a good time to take a pause and sort of scratch together all of the lessons learned, best practices, and things that we've learned through this phase, and pass it back on to the applicants as we face the winter months. So that's what we've asked. That's what our staff and our partners at Convalescent have done, and we appreciate you being here today with us. So with that, I'm going to turn it back over to Amanda. Thank you.
Thank you, Thad. And just to reiterate Thad's point, we do have Eleanor Conigo, on the line with us today. She has been one of our amazing partners with FEMA Region 1, helping the state and you as the applicant go forward with public assistance. So I just want to acknowledge Ellie and thank her for her time here today on this presentation. She will also be helping answer any questions and adding when I haven't said enough about something, and just adding more explanation when she sees necessary. So we wanted to start off by just providing a very high-level overview of this disaster. I get a lot of questions on what exactly DR 4496, what does it mean? So for every single disaster in every state gets what's called a disaster record. That's what that DR is. So since every state in the country has been declared for COVID-19, The Commonwealth's disaster record, or DR, for COVID-19 is 4496. So just some knowledge for you to be prepared if you wanted to come up with a fun fact at a cocktail party. The major disaster declaration was declared by the president on March 27, 2020. All counties in the Commonwealth were declared, meaning that if you are a school, municipality, or a private nonprofit operating a facility within the Commonwealth, you are most likely eligible for public assistance. You can claim costs going all the way back to January 20, 2022 if they were incurred for COVID-19 and are eligible. And as Thad, just to also reiterate another point that Thad made, this is an ongoing disaster. So, if we all had, if one of us had a crystal ball, I'm sure we could be millionaires just to figure out, just to predict when this pandemic would be over. But it is ongoing. So with that, we are seeing a lot of time extension requests pop up in Grants Portal. We do realize there are some odd dates that are popping up in Grants Portal that might be prompting you to request a time extension. You do not need to do that. Do not worry about requesting a time extension. It is not necessary at this time. When it is necessary to file a time extension, you will be given ample notice, and you will be getting email blasts just reiterating when you need to do it and how to go about it. So do not feel the need to do a time extension request. If you do, all you're going to get is an email from me saying, explaining what I just told you right now. So do not add another burden on yourself. You can take that off of your plate. I apologize. I want to go through my notes, make sure I covered everything on this slide. So it looks like I did. One more thing. So if you have done public assistance before and received grant funding through public assistance, perhaps for a past snowstorm, you may have been eligible for all sorts of activities, like construction activities, road repair, bridge repair, maybe one of your school facilities got damaged, so repairing that facility. This declaration only authorizes Category B emergency protective measures for COVID-19 response. Now, you might ask yourself, well, what's Category B emergency protective measures? We will be getting into that shortly. So just to go over what we will be getting into for the next hour, we will do an overview of the FEMA Public Assistance Program. Some of you may be first-time applicants, so just some really high-level points for you to keep in mind. We'll then be going into eligible activities and costs, which I do predict that will stir a lot of good conversation and a lot of activity in that chat box. And then finally, the required documentation that we will need in order to develop the project. So let's get started. So what is FEMA Public Assistance? The FEMA Public Assistance is financial assistance that is administered by FEMA to assist state, local, tribal governments, as well as certain private nonprofits for their response costs, in this case for COVID-19. The point of the program, there's an unprecedented disaster. We don't want you guys to, run into your budgets so that you couldn't continue to respond to COVID-19. This is a cost share program, which means FEMA will only reimburse 75% of eligible costs. What does that mean? Let's break that down. So let's say you have $1 million of eligible costs. Awesome. You can substantiate all that $1 million through receipts, invoices, timesheets, what have you. FEMA will only reimburse $750,000 of that $1 million, which means that you will be responsible for the remaining 25%. If you have any questions on that, please feel free to submit your question in that chat box. And then just to really emphasize that last paragraph that is bolded down there, FEMA will not duplicate any assistance that's provided by HHS or CDC, or most likely in school for your institution's cases, any federal funding received through Department of Education through the ESSER fund. You have to make sure, just to make it clear cut, no double dipping, right? You don't want to claim the same costs over multiple grant programs. So just make sure you're just keeping it a real good listing of what you paid for with the ESSER fund, and what you are seeking reimbursement for with FEMA public assistance, and then any other grant programs that you guys are going after. So the $1 million question, what are emergency protective measures? It's kind of broad, right? It sounds a little mysterious. So the statutory definition I have right here on the slide for you: an emergency protective measure is an activity undertaken to eliminate or lessen an immediate threat to lives, public health, or safety. So that sounds like that covers everything under the sun, right? Broad, maybe even a little vague, but let's get into exactly what emergency protective measures mean for the COVID-19 major disaster declaration. In order to help applicants figure out what's going to be eligible for each disaster, pretty much FEMA will issue fact sheets, which is specific guidance to that disaster that really just breaks down what is going to be eligible in order to help applicants navigate through public assistance. Now, the two main fact sheets that are going to be relevant to you guys is going to be the emergency protective measures generalized fact sheet. So there are two of them, and they are different in the periods of time that they cover. So the first fact sheet covers activities that were performed pre-September 15th. And the second fact sheet is for activities that were performed September 15th and beyond. I will say the first one, we're going to go over both in just a second. So again, if you have any questions percolating, feel free to submit them on the chat or wait until we get through those two fact sheets to submit them. The first set of guidance that we got pre-September 15th was vague, and it was very broad. And it was, confusing to folks and potentially misleading. The second piece of guidance that we received that now applies to post-September 15th costs is a lot more straightforward, a lot more direct, a lot clearer. What we are seeing between the two is really the difference between the two are how FEMA is applying that and the determination memos that we are receiving. So I'm going to go over the guidance, and then I want to go over with you guys how FEMA is applying that guidance and what we are seeing. So just some words before we get into it. So eligibility pre-September 15th, 2020. And just to go over, just to kind of cut to the chase, you guys, I can't imagine that schools are doing, all of these activities. We're certainly not seeing that, but we are seeing a good bit. We are seeing, for example, disinfection of your facilities. Now, I would like to point out disinfection of eligible public facilities here, and then I would like to go down to here. So in order for any of these activities to be eligible for reimbursement, one, you have to have the legal responsibility. Makes sense. That's really not an issue for you guys. It's, it's pretty clear cut that you have legal responsibility over your facilities. That's more of a question for the private nonprofits out there that offer educational services. Comes just a little bit more digging that we have to do. And second, it must be an eligible emergency protective measure. Okay, so let's get into it. So disinfection of eligible public facilities. FEMA has deemed that eligible public facilities are those that are responding to COVID-19. They have declared that that does not include or facilities offering educational services. That really more applies to EMS, ambulances, hospitals, police facilities that are directly dealing with COVID-19 and responding to COVID-19. I know a lot of this is going to prompt some questions, so feel free to enter those into the chat. What FEMA is allowing, though, is a one-time cleaning of your facilities during this time. that must be, sorry, I apologize, just lost my train of thought. So FEMA will reimburse for one-time cleaning of your facilities pre-September 15th if it is in accordance with CDC guidelines. And then I just saw on the chat, someone wants me to repeat that disinfection of eligible public facilities is not going to be eligible for schools. That is the case. Eligible public facilities does not include schools. But again, that one-time cleaning will be eligible if it was in line with CDC guidance. A couple of other activities that we're seeing schools perform is emergency feeding operations on behalf of the town. You just have to be careful. We have gotten a determination memo for a regional school that was providing school meals for its students during the summer when they were on break. FEMA has deemed that ineligible as increased operating expenses. But if you are doing emergency feeding on behalf of the town to, vulnerable populations, elderly populations, autoimmune population, those who are suspected or confirmed COVID-19, that will most likely be eligible for FEMA reimbursement. We have seen a lot of schools take on that mission on behalf of the town. Another popular cost that we see schools trying to go for, purchase, sorry, I apologize, PPE. And I don't see it on here, but that is a eligible cost for pre-September 15th. It's the purchase of PPE. You may have purchased some masks for your staff. You may have purchased some masks for your students, early on, at the last half of last school year, kind of when everything was unknown, March, April, in that time period. We have seen some of those go through, and I'll let Ellie take more of a deeper dive into this, but we are seeing that being denied more often now. So any cost for PPE that you incurred last school year most likely will be deemed ineligible, because it's just not that eligible emergency work. Again, FEMA does not consider educational services to be eligible emergency work under COVID-19. Now, if I missed any other expenses that you guys incurred September 15th, let me know. I think those were pretty big ones that I just hit. We can definitely go over other ones that you may have in the chat, but let's now discuss the post September 15th costs. And again, I actually just want to reiterate, at the bottom here is the link to the guidance. So we just took some snapshots for the most pertinent, so not to overwhelm you guys. Please do click on that link and review the guidance in its entirety, just so that you are fully prepared for administering this grant. Now, the post-September 15th guidance is a lot more clear-cut. It does go into, and I'll just go to the next slide here, does state eligible emergency work is performed. Eligible emergency work is performed. It does reiterate that for pretty much every single activity that we have, but that does also include the cleaning of facilities. So now, for cleaning, FEMA will reimburse for facilities that do not provide eligible emergency work, will provide reimbursement for cleanings if there was a suspected or confirmed COVID-19 case. For example, your post-September 15th, let's say you had in one of your classrooms, one of your teachers was confirmed COVID-19, was a confirmed COVID-19 patient. FEMA will reimburse for the cleaning of that classroom and any areas where that teacher may have gone. And I see Ellie, if you just want to unmute yourself and interrupt, you're more than welcome to. I saw that you just popped something in the chat, so we can definitely get into that later, but feel free to unmute and just
I don't
at-
like to interrupt.
Go ahead.
I don't like. So PPE, if it's been purchased to assist with the cleaning, the disinfecting of the classrooms and the school buildings, that will be eligible, because I know some of those cleaning chemicals can be terrible to inhale. PPE beyond that will not be eligible for schools, and social distancing measures will not be eligible as well. I understand totally that schools are doing these things to prevent contamination going forward, but this was really geared for medical. But we are allowing for that one-time cleaning of purchasing the materials, the labor, if you use a contractor, and so forth.
Thank you, Ellie. So I appreciate that. So every time you clean and it's eligible for reimbursement, if you purchase any PPE for your staff or whoever is going to be cleaning, that will be eligible for reimbursement. But again, that PPE has to be for staff who are performing that cleaning. So just thank you, Ellie. I appreciate that. And that cleaning, just Ellie mentioned this, I just want to do a little bit of a deeper dive. That cleaning can be done by your in-house staff if they have incurred overtime cleaning. I know a lot of schools do employ custodians to, do a lot of those activities. Only their overtime will be eligible for reimbursement if they were cleaning. Or if you have decided to contract it out to a vendor to come in and clean, that cleaning will be eligible for reimbursement. Again, if it was as a result of a suspected or confirmed COVID-19 case within your facility. I think we'll get a lot of questions on that, or I'm sure you guys have a lot of questions in your mind. Please feel free to utilize that chat function to ask your question. And again, just a lot clearer. I think a lot of you guys are doing temperature scannings, perhaps. You bought some equipment to do temperature scannings. Unfortunately, that is not going to be eligible for reimbursement, as the facility you have to be performing eligible emergency work in that facility. If temperature scanning is eligible in like hospitals that are, performing emergency medical care for COVID-19 patients, unfortunately not going to be eligible for schools in this case. Trying to think some other, Ellie mentioned social distancing. Any signage that you might have, unfortunately, will not be eligible. If you installed any physical barriers, unfortunately, such as plexiglass, unfortunately, that will not be eligible as well. Really, the costs, the ironclad costs that we have received come through will include the disinfection facilities under the cases that we discussed already, as well as any emergency feeding operations that you might be doing on behalf of the local government. And if you guys have any other ones that I missed, I'm sure there's other ones that I've missed, but those are the two really big costs that we're seeing from schools. But again, if you have any other costs that you are experiencing and you want us to go over, please pop that in the chat. I think I saw one or two come on testing, so we'll touch on that in just a sec as well. Documentation requirement. So if you have not had your exploratory call with your project coordinator, please reach out to them and get one scheduled. You are going to learn you're just going to learn a lot of new things about public assistance, including the difference between a small project and a large project. So a small project, exactly how it sounds. It is a project that is between $3,300 to $131,100. This is the documentation that is required for it. We need that electronic streamlined project application. That can only be filled out in the FEMA grants portal. Do not send me or email me PDF copies of this application. We will not accept it. It must be filled out on what I like to call the TurboTax form on the FEMA grants portal. If you need any help filling that out, please reach out to your project coordinator. We also have a very nifty training video on how to fill that out available on the MEMA website. Second, the MEMA workbook. The MEMA workbook is required for all projects. Now, if you have an Excel sheet that you have been working off of from the beginning of this disaster and you want to utilize that instead of the MEMA workbook, as long as it has all of the documentation that is in the MEMA workbook and it is in an editable format, we will work with you to accept that. I will say the MEMA workbook is macro enabled and it has a lot of awesome features. So I would definitely check that out. It is available on our MEMA website. If you cannot find it, let your project coordinator know. They will send you the latest version of it. I will say it is, you cannot paste into it. So I know that is a frustration on behalf of a lot of applicants. So again, if you run into that situation where you have an Excel workbook that you have been working off of since January 20th, and you have thousands of line items, and you don't want to redo it, just a huge administrative burden, we will work with you. Next up, subrecipient small project certification form. This is a new form for MEMA. It is available on our MEMA website, and we will need it signed by the authorized user for every single small project. The certification form has a series of assurances that MEMA needs in order to develop your project. Include such assurances as you can and will provide the source documentation at closeout, or if there is an audit, that you will maintain all documentation necessary in order to justify your cost. Now, why do we have that certification form? Because we do not ask for your source documentation for small projects. We may ask for source documentation if your project is over 125,000 or 120,000, but under 131,000, we may ask for sampling just to make sure everyone has the comfy cozies. But besides that, we'll not need to upload any source documentation, invoices, timesheets. That's what I mean by source documentation. Next, we will need your procurement policy. Then we will also need your pay policy and any applicable union contracts. We need to review those. We need to make sure they are 2 CFR 200 compliant. So that's all we need for a small project. Pretty easy peasy. Next step, for a large project or project that is in excess of $131,100. Similar to a small project, we need that electronic streamlined project application. Again, do not send me a PDF copy. You have to submit it on the FEMA grants portal. Next, that MEMA workbook. Again, if you are having issues with the MEMA workbook or have your own Excel sheet that has all the information we need, we will work with you to use that instead. Procurement policy, pay policy, and applicable union contracts. Now, here's where we need all of your source documentation, depending on what you're claiming, right? So if you're claiming any overtime for your custodial staff that we talked about earlier, we're going to need their timesheets, and we're also going to need the proof of payment that they were paid, usually a payroll register. Next up, forced account labor. So let's say you had those, bleach sprayers already purchased, and your custodial staff is using that in order to disinfect the facility after there has been a suspected or confirmed COVID-19 case. FEMA, and this is one of the benefits of the MEMA workbook, FEMA has a equipment usage rate sheet where you can actually get reimbursed for the hourly rate that that equipment is used. Pretty cool. We will need operator timesheets and logs. What we usually get is just like a one piece of paper saying Bob from 2 to 4 utilize the sprayer to clean classroom X or something like that. So that's what we're looking for, just something simple, just to show how long a piece of equipment was used for. And then also proof of ownership over that equipment. I know that's a little bit tough for especially the smaller items, but we can work with you guys on that. Materials and supplies, again, let's say you purchased some cleaning supplies that were within CDC guidance on cleaning those facilities. We're going to need those invoices. We're going to need those receipts. We're going to need to see that proof of payment. The receipt should suffice, or a bank statement. The best thing you can do is a canceled check, but I definitely understand that you may not be utilizing those at this point, as well as any procurement documentation. If it was competitively bid, we'll need those bid tabulations, anything like that. Contracts. So let's say you hired a vendor to clean your facility when there is a suspected or confirmed COVID-19 case. We're going to need to see those invoices, those receipts, that proof of payment, as well as any contract agreement that you have with them, and as well as any procurement documentation that you have for them. We're not seeing a lot of these being competitively procured. They're more emergency procurements. I don't want to get too much into that, but if you have any questions on it, definitely feel free to submit it into the chat, or feel free to ask your project coordinator on that, about that. So if you have any questions on documentation requirements, please feel free to submit them in the chat. And I believe that is the end of the presentation. And we will now go into the Q&A. So Nicole, I think I've seen Ellie respond to a couple. So Nicole, if you can filter the ones that remain unanswered, we can take it from there.
Sure. So we have a question from Judy Townsend. Is the cost to fix the school's HVAC system eligible?
Unfortunately, it will not be. We have had a couple of questions come through regarding, the HVAC system wasn't great to begin with. Even if that was the case or wasn't the case, unfortunately, any type of renovations for air quality is not going to be eligible for FEMA public assistance, since schools are not providing eligible emergency services. So that's going to be a no. Kind of kills me to say that, but it's going to be a no.
Kills me to always say no as well.
All right. Next was from Karen Kruppa. Will asymptomatic testing programs for students and staff be covered?
Unfortunately, so that sounds more like community-based testing. That is not the only entity that has the authority to provide community-based testing is the local municipality, is the government. So what I've seen a lot of schools do, which is pretty interesting, is they will require their staff, I don't think I've really seen it with the population, but they will require their staff to get tested every week at a testing site that is run by a local municipality, that is run by the town or through their insurance, and provide proof that they got tested and that it is negative. But if the school tests the teachers and the students directly, that will unfortunately not be eligible for reimbursement. That sounds like a great opportunity, though, to partner with your town to try and get a testing site closer, more centrally located to the schools in order to make that happen.
All right. Eileen Riley asked, how about COVID test purchase or HVAC items such as HVAC assessment or installation of air filter and window screens?
That's awesome. That kind of combined the first two questions we went over. Unfortunately, both the responses that I previously gave will apply to that question as well. It's going to be a no to both of those. Again, hurts me to say that.
Liana McLaren asked, we are a school and had a one-time cleaning done in March and we purchased PPE in August. Is any of this eligible?
So the one-time cleaning, so, without having a little bit more information, and Ellie, feel free to chime in. The one-time cleaning in March sounds eligible to me, especially if, it was right after school was, was released for summer vacation or an early dismissal for summer vacation. That sounds to be eligible to me. Unfortunately, if the PPE that was purchased in August is for staff or student usage just for teaching, that will most likely be ineligible for reimbursement. Now, if any of that PPE is being used for eligible cleaning going forward, you can definitely claim that as you're claiming those cleanings that are performed as a result of a confirmed or suspected COVID-19 case. But Ellie, check me.
You are absolutely correct. And what is also extremely helpful on my end is if you identify in your materials what it's exactly being used for. So if you are doing that first time cleaning, and some of these schools are large, some have multiple buildings, and it takes many days or a couple of weeks, few weeks to clean them all. I expect to see a period of time of cleaning. So if these materials were purchased in conjunction to that cleaning, please identify that these are materials that are being used to complete the first time cleaning for the schools. That way, there's no question mark, and I won't be reaching back to you for more information.
And Amanda, I think that concludes all the questions, besides whether or not the PowerPoint will be distributed to everyone or available online.
So we will be posting the presentation on our MEMA website. We still have, and we will be emailing everyone directly to notify them that the materials are on the MEMA website. We probably will also just include that email, the presentation. I think the recording is going to be the recording we're probably going to put on YouTube, so we can probably do a link to the YouTube. That's actually a great idea, Miss Lee. I'm going to make a note of that just to go ahead and include the materials in the email, the notification email that we send out to all of you. So it'll be yes and yes.
We do also have one more question. Does anyone know of any technology funding available to address remote learning for COVID?
The FEMA has a really great, and Ellie, I apologize, the name of it is just blanking on me, but coordinated funding streams that you can type in what activity you want to get funded, and it will tell you, it will show you the funding streams that may help with that. I'll also include that link in the email, and I believe it's already on our MEMA website. So if you just want to go on our website and search for it, it should be there. But I'll make sure that that's included in the email as well. Really, I mean, COVID, the CRF Coronavirus Relief Fund that was administered to your municipalities can be used for remote learning, as well as the ESSER fund, and I apologize, I forget what it stands for. It's like the Elementary Secondary School Relief Fund that was administered through Department of Education. I do understand that was not a huge allocation if you did receive any, that it may not have covered those costs. Those are the only two I can think of, but if anyone has any other grants that they would like to share, Ellie, if you know of any others that you would like to share.
I sent MEMA a PDF of, I think there was 37 different federal agencies that have funding available. And of course, I don't know them. I didn't really look at it. I just forwarded it for information. So I can try and find that again, and maybe Erica or Lorraine might have a copy of it as well. But there are other funding sources to go to for items that unfortunately FEMA cannot fund. And in respect to, I think to pronounce the name AVI, I don't want to kill the name, I'm sorry. If you put in submitted a project in mid-October, please be aware, anybody that submitted a project, we have 800 plus projects going through the system right now. And all of them are in some form or another in a different queue. So please know that it will be addressed as soon as possible. It's just, a difficult lift for all of us, MEMA as well as FEMA, because unfortunately, I'm the only one reviewing on the FEMA side right now. So it takes time to get through these projects, but we're trying to do it as quickly as we can. But please know it will be reviewed and a follow-up if we need anything else.
Thanks, Ellie. Does that conclude the questions, Nicole?
Other than the response from Avi just now, we do not have any other questions.
I just saw one more asking about the CARES Act. So from what I understand with the CARES Act, even though it expires in December, the end of this year, if you have expenses that occurred before that, they will still accept your application. So even if we haven't gotten to you yet, you are still able to apply to them as long as your expenses are before December 30th.
And also, if you have, so if MEMA, so before, when you submit your project, review it, MEMA reviews it before we submit it to FEMA, and we will issue a request for information that will usually outline items that we believe are ineligible. If you received such an RFI that kind of hinted at maybe some costs being ineligible or asking whether or not you wanted to include those costs, you can usually take that email and provide it to A&F to show, A&F Admin and Finance, who's administering COVID relief funding. You can usually take that to them and just show that MEMA does not believe that these costs are eligible. So we will not be seeking them for public assistance and go directly to them to cover those costs. So if you have any doubt, you can email your project coordinator. We can go over the cost with you. We can give you a very blunt response of what we think will most likely be deemed ineligible, and that should help A&F figure out how much funding they need to provide before 12/30. Now, after 12/30, when this is not an option, we will continue working with you guys to make sure that you have a strong package, a strong project, so that FEMA won't scrutinize it, and there is always an appeal option.
All right, one more from Carol Lee, Amanda. When submitting a project, were we supposed to get an email indicating that the project was submitted? I did not get an email and submitted last week.
No, I don't believe that Grants Portal generates an email. I can definitely look into your project, Ms. Lee, and just kind of give you an update of where it is. Hold on, let me just make a note of that. But if you go into FEMA Grants Portal, you can see where it is in the process. If you submitted it to us last week, it's probably with us for review, and we'll probably advance it shortly, or at least issue an RFI just asking for additional information. But I'll track that down. I know Michaela is your project coordinator, so I'll track down with her and see where that project is.
Unless anyone has any final questions, there's nothing pending in the chat.
Okay, well, again, we will be posting this recording of this presentation as well as a copy of the actual PowerPoint, as well as an Excel version of all the questions that were asked during this chat with responses to all of that. If you have any other questions, feel free to utilize the link at the bottom of this slide. It says questions, ? That is the form stack form that you can go in and submit a question, and myself or someone from my team will be in touch to answer your eligibility question. So I want to thank you all for your participation today. And again, I just want to thank you guys for what you are doing and the circumstances in which you are doing it. You know, we do appreciate everything that you are doing, and we could not, you know, continue or respond without your support. So thanks everyone, and have a great day and have a safe weekend.